Hello, my name is Michael Redman. I'm a fourth-year psychology student studying abroad here at the University of Limerick in Ireland. Today is October 28th, 2014, and this podcast will be taking a look at the psychological disorder known as schizophrenia. The term comes from the Greek root schichon, which means to split, and phren meaning mind. So literally translated, schizophrenia means split mind. But this does not mean the person has a split mind as in different personalities. Schizophrenia is actually characterized by disturbances in thought, emotion, and overall behavior. So schizophrenia is a mental illness with various different symptoms. The first ones are positive symptoms. These are hallucinations in which the subjects believe one thing contrary to the information they are receiving from the environment, and they could also have delusions, which for some people believe that thoughts are implanted in their mind, which is known as thought insertion, or that their thoughts are being broadcast, which is known as thought broadcast. Schizophrenia also has negative symptoms as well. This could be marked by a loss of motivation, which is apathy, a loss of pleasure, which is anhedonia, a loss of outward expression, which is known as flat affect, and even impairments in their social relationships known as asociality. Schizophrenia also has disorganized symptoms as well, with disorganized speech, meaning that people do not actually have coherent speech, or their behavior itself could be disorganized in that they dress differently or they collect odd things. The Diagnostic and Statistical Manual, or the DSM, is a manual that was created in the US and used to determine if someone is considered to have a disorder. The DSM is used to try to diagnose disorders all around the world. So there's certain criteria that the DSM presents in order for people to be classified to have certain disorders. So, for example, in order to have schizophrenia, there must be the presence of two or more characteristic symptoms, such as hallucinations or even delusions, and a negative symptom, evidence of social or occupational dysfunction, continuous signs of disturbance for 6 months, exclusion of mood disorders, particularly bipolar disorder, and also exclusion of cause by substance abuse or a pre-existing medical condition. So why exactly does schizophrenia occur? Well, one hypothesis is that schizophrenia develops as a result of severe psychological stress, with the environment playing a large role in influencing this development. The sociogenic hypothesis explains that the environment itself acts on those who are genetically predisposed to schizophrenia and then aggravates these predispositions and influences the overall development of schizophrenia. Harrison, Gunnell, Glazebrook, Page, and Kaniewski examined the role of the environment on the development of schizophrenia. What they did is they specifically examined two indicators of social inequality at birth: social class and the area of residency. Participants for this study were identified using a psychosis screening known as the Schedules for Clinical Assessment in Neuropsychiatry and other in-depth assessments such as the Family History Research Diagnostic Criteria. The father's occupation was used to determine the social class, while the mother's address was used to determine the location of residence. Zones were then created to measure the level of deprivation. Such indicators that were used were income, unemployment, crime in the area, housing, among many different indicators. Results show that deprivation score had a significant association with schizophrenia, with 71% of the subjects being classified as having schizophrenia. Researchers ultimately determined that lower socioeconomic status is linked to a higher risk of developing schizophrenia as well as other psychoses in life such as depression. So this research has a few important implications. For one, it shows that not only nature, which is how we are genetically, influences how we become, but the environment also interacts to influence the expression of an overall disorder and who we become. A second implication is the powerful effect of our environment has on us. So by implementing ways to help change these negative environments, we can reduce the prevalence of the overall disorder. So while people may be genetically predisposed to something like schizophrenia, we can actually take precautionary measures to prevent this from continuing. So in summary, schizophrenia is a psychological disorder characterized by disturbances in thought, emotion, and overall behavior. There are three areas of symptoms: positive, negative, and disorganized. Schizophrenia is thought to be brought on by some sort of psychological distress. According to the sociogenic hypothesis, this comes from the environment. But most importantly, not all people with schizophrenia are dangerous. Many famous people have been diagnosed and they were never dangerous. Mary Todd Lincoln was the wife of President Abraham Lincoln, and she was a successful First Lady. Vincent van Gogh went on to create some of the most iconic paintings in the world. Even John Nash, who is the subject of the movie A Beautiful Mind, became a Nobel laureate in economics. So thank you so much for watching, and have a nice day.